live. You're watching Fox 44 News First Edition.
Well, February is Heart Month, and all month long we're talking about heart health and ways to just stay healthy. So joining us live via Zoom is Dr. Desiree Dawson, who's a cardiologist with Oshner, about how to stay healthy. Good morning.
Good morning.
All right, so of course February is Heart Month. We're talking about it all month long, but it's something not just to talk about just in the month of February, but just something year round.
Yeah, it is something to talk about year round, especially, we try to give the awareness out now in February because it's all about women, Go Red for Women, Heart Month. But all year round for sure, because we want everyone to know that heart disease is the #1 killer in women. It's not cancer and it's not anything else that you can think of, but we want people to know that, hey, you gotta be aware of what's going on in your bodies. If you're concerned about new symptoms of like chest pain, shortness of breath, you have a family history, you have a history of smoking, alcohol use, and diabetes, blood pressure, you should definitely get checked out by a cardiologist. Pandemic has come and people are less active now and have not been exercising and eating pretty poorly. And so it's now time to get our rhythm back. And I know that heart disease is out there and it is definitely running rampant in all of our communities.
Absolutely. And if someone has a family history, how early on in their life, like at what age should someone, be checking on their heart health?
That's a great question. It can be as early as 35, 34, especially if you have a family history of mom, dad had a heart attack at age 50, 40s. Like those are premature ages to have heart disease, pretty significant. And so it's any time is better than none, actually. And I know as young people growing up, you think like, hey, I don't have to see a doctor soon. But if it runs in your family, even diabetes, blood pressure, just to get checked out is very important. And I always say, know your body. And if you're concerned about any symptom that was new and hadn't been there before, definitely get checked out. It's okay. It's okay to have a visit and find out there's nothing wrong, but it's better to know that than to go forward and just kind of wishing and wondering, if there's something going on and not know for sure.
Absolutely. And of course, it's Black History Month as well. So it's heart disease, that's a common thing in the African American community as well.
Yeah, it is definitely. And I know like in our communities, blood pressure runs high, diabetes, we're prone to having those risks. And so it's important in our families that we make sure we get checked out as well, go to see a doctor. Access to healthcare is very important in our community. So we want to make sure we get to a physician, get checked out where we need to get checked out, make sure we're living a healthy lifestyle. Obesity runs rampant in everyone's community as well. So that's important, like your weight loss, eating healthy, knowing your numbers, cholesterol, sugars, blood pressure, all those things are important. And I always try to stress to patients like smoking and alcohol use, all those play a toll on your body and they do definitely contribute to heart disease.
Absolutely. So if you want to have a healthy and long life, definitely got to start getting moving and get active. But we'll have all those tips on our website that will be posted for you on brproud.com as well as our free BR Proud app. Thank you so much, Dr. Dawson.
Absolutely. Thank you so much for having me.
Anytime.